Hey guys, it's Dr. Scott Leslie here again. I'm going to kind of continue down with the hand and wrist. As I always say, please use this as a supplement to your notes. I try to be as thorough as I can with these videos since I just started. This is the third video I'm trying to put together. As usual, again, as I try to improve these, I will, repost them for you either on Google Classroom or on the YouTube channel. I may even get a Facebook page together so you guys can access these. But again, it's supposed to supplement. So if I omit something, please look at your notes or the practical laundry list of items that you need to know for the practical examination. Also, sometimes I'll misspeak. So just, I'm not perfect. I'll try to be as accurate as I can and make sure I'm not talking faster than I'm thinking. Okay. So we had done the elbow. We've last video, as well as the proximal humerus, and we do have the scapular video out there. So we want to kind of move down to the wrist and fingers. This one video may come out a little bit better than the elbow video since I have a little better positioning with the technology. Again, as this improves, I will make better quality videos. So now what we're looking at here, the anterior side of your hand and wrist. So we're in anatomical position. So your palms are facing forward. Okay. We have the distal radius. Okay. We've got the distal ulna. Remember, we got the styloid process here on the distal radius. We also have a styloid process on the ulna. Okay. Remember, we have pronation and supination that occurs at the radial ulnar joint, as well as there's some rotation around the wrist. Now, we're going to have two rows. The next row of bones are between the radiocarpal joint and the ulnar carpal joint. We're going to have two rows of 4 bones. Okay, we're going to have a proximal row, which is 1, 2, 3, 4. You can see they don't line up in a perfect line. Okay, and then we're going to have 1, 2, 3, 4. We're going to have a distal row. Now, the first bone, remember we used a mnemonic. Some lovers try positions that they cannot handle. Okay, we have that in our notes. The first bone is going to be the scaphoid, which is right here. It's going to be the proximal row, the lateral bone, most lateral bone, proximal row. The lunate, which is shaped like a moon, take my word for it, you don't see it here, is the next bone that's a little bit more medial. We're going to have the triquetrum bone, which is right here. And then, because this is plastic, we got the pisiform sticking out. Now, my pisiform on my hand and wrist, and I'm going to try to zoom out here a little bit, okay, I'm going to put my eraser right there. Okay, so this is my pisiform. If I go back to the scaphoid, okay, when I extend my thumb back, okay, you call this the anatomical snuff box. If I push in there, you're going to feel 2 tendons. One tendon is going to be abductor pollicis longus. The other one's going to be extensor pollicis brevis. In de Quervain syndrome, common problem, there's tendinitis or tendinosis in those tendons. Okay. But this is the anatomical snuff box. Probably back in the Old West, they probably were taking their quote-unquote snuff and putting it in there. But that kind of marks where the scaphoid is. Remember, the scaphoid is the most common bone to fracture. You get a client who comes to you and they have pinpoint pain, swelling. There may not be much you can help them with their hand and wrist. The lunate's going to be the most common bone, which is right next to it, which is going to be the most common bone to dislocate. Okay, but here's where the scaphoid kind of resides. We're on the dorsum side. So remember, I'm not in anatomical position right here. It's going to be on the thumb side. Okay, and if we look at our bones here, we know it's thumb side because again, here's our 2 phalanges, which again I'm going to explain those in a second. So we got scaphoid, lunate, triquetrum, and then the pisiform. Okay, the pisiform is very easy to palpate on the medial side of your wrist, like I just showed you before. Okay, in chiropractic, a lot of times we use this as a contact point. You may even use it as massage therapists. All right, then we've got going back to the distal row now, starting on the lateral side. We got the trapezium and the trapezoid. Now remember, I usually tell you to remember MD, think of medical doctor. okay, because there are a lot of T's, right? There's triquetrium over here, okay, and we got trapezium trapezoid. Capitate lines up with the third metacarpal, which if you're brand new to anatomy, you're going to learn about the metacarpals in just a second, but think of it's the third finger. Remember, we name first finger the thumb, 1, 2, index finger, 3, middle finger, 4, ring finger, 5, the pinky finger, or we'll learn it as digiti minimi in a minute, okay? So we've got the capitate. So 1, 2, 3. Then we've got the hamate. Okay, so we're on the lateral view hamate. So the hamate is kind of lined up with the pisiform from the proximal row. So these rows, there's ligaments that run in here. You fall an outstretched hand, you can sprain them. A lot of times they get overlooked as long as there's not fractures, but clients can sprain them. Of course, you're going to have tendons that are going to run through here. And you're going to have the carpal tunnel ligament, okay, which is going to be what we call retinaculum, the palmar retinaculum. Okay, we're going to have the median nerve that's going to pass right through here, going down to the hand. Carpal tunnel syndrome is compression of that nerve passing through the wrist. And there's a lot of different reasons. We'll cover it in kinesiology when it gets compressed, but they get numbness in the first 3.5 fingers, wake shake sign, things like that. Okay, as we move further distal, okay, here's our carpals. Okay, we call these bones the scaphoid, lunate, and so on and so forth, carpal bones. In the foot, we'll learn them as tarsals. Okay, there's tarsals, but they're carpals in the hand. Then we're going to go to the metacarpals. Okay, and we're going to have 5. So we got 1, 2, 3, 4, 5. Okay, so the big finger is going to be the first metacarpal, second, third, fourth, fifth. We're going to have a base. Okay, the base is usually more proximal. Remember, closer towards the joint. Okay, we're going to have the shaft, and then we're going to have the head. Okay, so base, shaft, head. Okay, base, shaft, head, base, shaft, head. Okay, if we turn our wrist over, if you look at my hand, when I kind of make a fist here, all right, these are going to be the heads of my metacarpals. Through my palm of my hand, okay, it's going to be the actual shaft of the metacarpal. Okay, so these are going to be my metacarpals. This is my second metacarpal, third metacarpal, fourth, and fifth in my hand. Okay, so you can even see my tendons coming out, which coming off of these are going to be what? Extensor tendons, right? They're going to be on this side of the hand, and they're going to go up to where? The lateral epicondyle at the elbow from the elbow video. Okay, so these are the tendons that are coming out. Okay, so if we go a little bit further distal, okay, we have, let me just kind of bring my arm up here a little bit and try to spread these out. Okay, we're going to have the phalanges. Okay, we're going to have a proximal in the thumb. Here's the thumb side because there's going to be 2 phalanges on the thumb, 3 phalanges, okay, on all the other fingers. This guy's looks like they got a little rheumatoid arthritis with the fingers being bent, okay, but the other fingers have 3. So we're going to have a proximal distal phalange. Proximal, again, remember from terminology, closer to the joint. We're going to have the proximal, middle, and distal phalange in the other fingers, okay, going all the way to the pinky finger, which we, again, if you see terms and muscles, digiti minimi, we know it's on the little finger side, right, quote-unquote little finger side, 5th finger. If you see the term pollicis, I just showed you on the other side, extensor pollicis brevis, okay? Anytime you see pollicis, it's going to the thumb, and there's several muscles. We're not going to cover all the muscles on these videos right now. When I do maybe some videos showing you the surface anatomy, when I get to those, we will talk more about those. Now, the joints, okay? We kind of cover this in class, but just so you can see it, we have the radial and ulnar carpal joint, right? From the radius in the carpal and the ulna to the carpals. We're going to have the mid-carpal joint. Okay, those mid-carpals is not a straight line, but it's between the proximal and the distal row of carpal bones. Then we're going to have the carpal metacarpal joint. Remember, the easy part about it is that we're naming the actual bone to the next bone that kind of crosses and forms the joint. So these are carpals, and metacarpals. We sometimes abbreviate it CMC. So this would be the first carpal metacarpal joint, the second carpal metacarpal joint, third, fourth, and fifth. Okay, as we go further down, okay, and these are going to be more. This area up here is more kind of in that wrist area, okay, what we call the quote-unquote wrist, okay. As we go further down, okay, we're going to have metacarpal phalangeal joints, okay, first, okay, well, here we go, first, second, third, fourth. Sometimes I'm looking back and forth in the camera here and putting the pencil in the wrong spot, but first, second, third, fourth, and fifth. Metacarpal phalangeal joint. Metacarpal phalangeal joints, second metacarpal phalangeal joint, third metacarpal phalangeal joint. Sometimes we call them MCP joints for short if you do SOAP notes. Okay, and again, that's when I make my fist, all right, and these are the metacarpals in the palm of my hand and the back of my hand here, and then there's my first, okay, phalange, proximal phalange, so my metacarpal phalangeal joint. Then as we go further down, we're going to have the proximal interphalangeal joint, okay, because this is a phalange, right? This is the proximal phalange. And then we're going to have the distal, okay. Let's just turn our camera here a little bit. Okay. We're going to have our distal interphalangeal joint, okay. So proximal and distal interphalangeal joint. Distal phalange, middle phalange, proximal phalange. Okay, so when I bend my finger here, okay, this is going to be the distal interphalangeal joint right here. If I make a crooked finger here, proximal interphalangeal joint, and then metacarpal phalangeal joint. All right, and then again, we usually name it 1, 2, 3, 4, 5. Okay, thumb being the first finger. Remember, off of the medial epicondyle of the elbow, okay? We did that on the last video. The flexor muscles, this is the palm of the hand we're looking at here. All right, so let me see if I can zoom ourselves down and bring this down. Okay, so here's the palm of the hand. Now, flexor digitorum profundus is going to go down to the distal phalange. Superficialis, remember it splits. I showed you the cadaver picture. Okay, if not, I'm about to show it to you. It's going to stop at the middle phalange. Remember, it kind of pierces like this, the superficialis, and the profundus passes right through and goes to the end. So profundus, again, is going to cause flexion of the distal interphalangeal joint, kind of where my thumb is pointing. And then superficialis is going to cause flexion. Flexor digitorum superficialis is going to cause flexion of the proximal interphalangeal joint. Okay, guys? So I'm going to end it there with the hand and wrist. Again, just as a reminder, I'm trying to make these a little better each time. I understand I don't have $10,000 worth of camera equipment. I'm trying to make this a way you can study without just sheerly looking at the books. I am going to probably make some updates to this. And I appreciate your patience with the inaccuracy with the camera. All right? So have a great day, guys. Bye-bye.